Welcome, everyone, to our fourth annual Stomach Cancer Conference. I am Teresa Tiano. I am the chair and one of the co-founders of My Gut Feeling. And I am a 9-year survivor of stage 2B stomach cancer. Katy?
I'm Katy Kosyachkova. I am one of the co-founders. I am vice chair of My Gut Feeling Stomach Cancer Foundation. I am a 10-year stomach cancer survivor, and I'm so honored to be presenting and have you guys all join us today virtually.
So, good morning to those of you on the West Coast, and good afternoon to those of you on the East Coast. We're thrilled to have speakers and participants from around the world. So, buon apremidi, buenas tardes, buon pomeriggio, guten tag, boa tarde. It has been the most difficult of years, we know that. With the worldwide COVID pandemic, we have all had to live our lives very differently. It has been challenging, to say the least. A big reason we have our conferences is to bring the patient community and the healthcare community together. And we hope that although we are joining virtually, everyone who's participating will still feel together. We have incredible speakers, which I know we will all learn from. So before we begin the program, we want to thank our sponsors, Lilly Canada, who is our title sponsor, Bristol Myers Squibb, who is our platinum sponsor, and Taiho Pharma Canada Inc., who is our gold sponsor. Their support allows us to do the work that we do. And just a few important notes. If you have any questions for the speakers as they're going through their presentations, please submit them via the chat. If we do not get to your question today during the panel discussions, we will work both with the presenters and our medical advisory board to ensure that your questions are answered, and we will bring them to you either through our website or on Facebook. Also, if you have any technical issues, please direct your questions into the chat, and our event coordinator, Stephanie, will try and help you with all of that. So we will begin the program. Katy?
All right. Yes. So it's a bit of a challenge, as you guys can see, because we can't see you. So we're basically talking to a camera, but we hope that you guys can hear us well and that we can keep you guys engaged. We've had a very busy year. COVID aside, My Gut Feeling has done a lot this year. And in honor of that, we'd like to tell you guys what we've been up to. So the first thing that we've done is we've expanded our board of directors.
So yes, this year we increased the size of our board of directors to 7 people. Each one, besides Katy and myself, of course, brings special skills to the board and has been affected by stomach cancer in a very personal way. Their commitment to the cause is very important to the work we do. So I'd like to just introduce the board members. So it's Ramin Dravian, who is a caregiver, Emma Bernardo, also a caregiver, Dr. Christine Bresden-Masley, who's a medical oncologist who specializes in gastric cancer and was actually quite key to Katy and I founding My Gut Feeling. Lena Miranda, who is a 19-year stage 3B stomach cancer survivor, and her voice as a survivor brings so much hope and is so important to all our members. And last but not least, Ramandeep Singh Baga, who is a caregiver who lost his wife to stomach cancer in 2017. So we thank the newest members of our board, and we look forward to having a very productive and strategic year as we go forward.
Also this year, we've started our medical advisory board. So we get a lot of questions from people about what to do with stomach cancer. Obviously, Teresa and I, although we try our very best, we don't have the medical knowledge to give you the answers to those questions. And that was the big reason for establishing this medical advisory board. So we're really honored to have all these wonderful members on it. So Melissa Aronson, she's a genetic counselor. Dr. Brar, surgical oncologist. Dr. Christine Bresden-Masley is a medical oncologist. Dr. Natalie Coburn is a surgical oncologist. Denise Gabrielson is a registered dietitian. Dr. Terrence Lee is an internal medicine doctor and a stage 4 stomach cancer survivor. Dr. Howard Lim is a surgical oncologist, and Dr. Stephanie Snow is a medical oncologist. And these are board members from all across the country. So it's not just Toronto. We have members from the East Coast to the West Coast.
So the 4 pillars of My Gut Feeling, the Stomach Cancer Foundation of Canada are support, education, awareness, and advocacy. And we will go into a little bit of detail on each one of those. So support is the heart of our foundation. It was the reason we started My Gut Feeling, so that others would not have to go through the journey like we did. Our support is based on personal experience, as we know that those that have gone through it know and truly understand the journey. We provide support from the time of diagnosis and, unfortunately, sometimes right through to end of life. Support happens either via phone call, via email, over Facebook. Pre-COVID, it would happen in person. We've also often gone to medical appointments with patients. And our support groups, which are really, really the real heart, used to be monthly. But since COVID, we have gone to virtual meetings, which are bi-weekly. And it is what our members really needed at the time when COVID began. People were feeling very alone and very anxious. And so we have since about April been doing them bi-weekly. And they are completely confidential. They are anything that people want to ask, they are more than welcome to ask. And let me tell you, we talk about absolutely everything within these support groups. And we have a very great core of people that join. And we provide support across the stomach cancer journey. And for information on wanting to join, please either contact us via email or go to our website and contact us through the Join Us tab.
Our next pillar is education, and actually today is a great example of the type of education that we do for the stomach cancer community. So the point of our 4th annual stomach cancer conference is to bridge the gap between patient survivors and caregivers and the medical community out there. So we're trying to build bridges. We're not just giving you guys the most up-to-date stomach cancer information. We're also sharing stories so that healthcare professionals really understand the complex nature of stomach cancer. Here is our last panel, and pre-COVID, obviously, we were all nice and cozy in a big lecture hall. Now it's a little bit less personal, but we're still committed to giving you guys a wonderful program today. Another example of education that we've been doing is we've partnered with Dietitians of Canada and Elixir Kitchen here at Princess Margaret Hospital. And we've come up with a recipe book for stomach cancer patients. So we know how hard it is to eat. I know myself, I had a total gastrectomy. I had chemotherapy and radiation. It was awful. Lots of weight loss, lots of dumping syndrome, loss of appetite. So we really took these things into consideration. And whether you're pre-op or post-op, these recipes are hopefully easy to digest and will let you enjoy food again. They're packed with nutrients, optimizing fats and proteins. And it's available on our website. It was available in your e-package. And if you want a physical copy, we can also arrange that for you as well.
So just before I speak about advocacy, I also want to, sorry, there was a bit of technical back issues there. So I just wanted to also remind you that if you want to look at the program brochure for the day, you can also, it was also part of the e-package that was sent out to people that registered in advance. So advocacy is also one of the four pillars of our foundation. Last fall, we participated as the patient advocacy group in a PCODER submission, which is, PCODER is the body that conducts reviews on new drugs in Canada. We conducted an international survey, and through the responses provided from the patient community, we submitted a report that helped to have a new drug approved in Canada for stomach cancer treatment. And as we all know, having more options for this life-altering disease is so important. Also, earlier this year, My Gut Feeling joined the patient advocacy team of Storming Cancer, a groundbreaking international research project that looks at the effects of inflammation on various cancers, including lung, colon, esophageal, and stomach. This 6-year, $35 million project was funded by Cancer Research UK's Grand Challenge. The researchers and scientists are from the US, Canada, England, and Israel, and they aim to target the cells and tissues surrounding a tumor that could benefit up to 1 in 4 with cancer around the world. The patient advocacy with the other Storming Cancer teams, so there's different teams that focus on different areas, provides information so that patients can better understand the research. And we also help patients and the public understand ways that chronic inflammation in the body can lead to cancers. And also, as part of our advocacy this past year, we collaborated and contributed to the publication Patient-Reported Symptoms in Metastatic Gastric Patients in the Last 6 Months of Life. And we also collaborated on 3 grant submissions to the Canadian Institute of Health Research to fund research in stomach cancer treatment and quality and access to care.
And then the last pillar of our organization is awareness. And as some of you know, actually this Monday, so that's November 30th, it's Stomach Cancer Awareness Day. So we're really, really proud of this day because we are expanding awareness about stomach cancer. And this year we have 21 landmarks from the east to the west coast across Canada lighting up in honor of stomach cancer. And we definitely hope that you will join us to celebrate this Monday, whether it's honoring a lost loved one or honoring someone that's going through their journey. Let's spread awareness about stomach cancer.
We also last year started the I Live Without a Stomach awareness and fundraising campaign. And we did that with our, let me see if you can see the pin. It's up on the screen, but I'm wearing it. And it's the I Live Without a Stomach. And it's a pin for patients and survivors living without a stomach to show strength. So we have had many requests for it, and it is available online on our Shop for Tummies store. And hopefully our awareness will grow into the US in the coming years. This year was a bit difficult with COVID, but our aim is to make this day, just like November Stomach Cancer Awareness Month, we would love to have Stomach Cancer Awareness Day be recognized around the world.